Hi, today we're excited to present ProtAIn, a platform technology company for creating and screening new protein nanocarriers with generative artificial intelligence. And we're the student team leading this effort from the bioengineering department and Sloan at MIT. As we consider the landscape of nanocarriers, we see that current delivery systems have a combination of safety, immunogenicity, capacity, and manufacturing limitations. So a delivery system consists of two key components, the payload and the vehicle. The payload is the therapeutic cargo to deliver, with common examples shown on the left. And on the right, there's a variety of vehicles we can see, some of which are payload specific. The four main ones are shown. Viral vectors have the principal advantage of longer-term efficacy, which of course is crucial for therapeutic applications, but yet they're still quite immunogenic and are not redosable. Moreover, they're difficult to manufacture at large scale and have a 4.8 kilobase payload capacity. On the other hand, lipid nanoparticles are effective for weeks to months and are redosable, but they're still immunogenic after many doses and have limited delivery to organs outside the liver if delivered systemically. GalNAc conjugates are quite effective, but only for siRNA to the liver. And lastly, non-viral protein nanocarriers. There are a limited number of examples, but they've been shown to be effective for durations comparable to those of LNPs. Moreover, protein space is much more engineerable for high throughput experimentation. Crucially, if the protein nanocarrier consisted of an endogenous protein, that could mean the vehicle is non-immunogenic and redosable. And for these reasons, we're focusing on efforts on greatly increasing the number of endogenous protein nanocarriers at ProtAIn. So at the crux of ProtAIn is the application of new advances in generative AI technology to create many more endogenous protein nanocarriers. Protein space benefits from having a very rich database called the Protein Data Bank that consists of many proteins, hundreds of thousands to train on. This has allowed for research and industry to explore the use of generative AI for the computational design of proteins according to desired structural and functional properties. At ProtAIn, we'll harness the rich protein data bank and create custom generative AI models tailored for the design of nanocarriers to vastly expand the space of endogenous protein nanocarriers and expand the space far beyond the single endogenous protein, not yet even proven in vivo by the startup Era Therapeutics.
So there are many computational advances that underlie what we're going to do, but to break it down simply, here's the picture of what we plan to do. Basically, once the model is trained, you can take two common human proteins, one of which has a DNA RNA binding domain, position them artificially in silico in the shape of a capsid, and then the model just fills in the spaces in order to give you back the full capsid structure and sequence. So by itself, this doesn't really mean anything to have a bunch of designs computationally. So this is where the second half of our screening pipeline, which can take hundreds of thousands of these model-generated capsid structures and sequences, synthesize them all, and then screen them in vivo or in vitro for their ability to deliver whatever payload that you want to whatever cell type that you want, and then give you a mapping of the sequence to function at the back end. And the bottom line is that at the end, you should have capsids which are minimally immunogenic, can carry any payload that you want, and have true cell type specificity in vivo. Essentially, all the desired characteristics for the future of human medicine.
Today, the market for nanoscale delivery systems is dominated by viral capsids, which, as we've shown, have several disadvantages. Despite this, the global gene delivery market was valued at $3 billion in 2021 and projected to exceed $11 billion by 2030. Furthermore, increasing investments in the space by both VC firms and big pharma companies is very promising. And as this space becomes saturated with delivery systems that are not redosable, we expect our company to come in and quickly address this need for redosable delivery systems. More and more therapeutics from both biotech startups as well as big pharma companies are becoming reliant on nanoscale delivery systems, especially gene therapy. However, establishing an in-house viral capsid manufacturing pipeline is hard. It requires a lot of time, money, resources, and know-how, and for a smart startup, this can be impossible. This is where we come in. With our build your own capsid strategy, our company brings the pipeline so that our customers don't have to. Whether our customers want to package DNA, RNA, or something else entirely. All they need to do is provide capsid specifications, and we provide the delivery capsid. That's it. Our clients take it from here. What this means is that ProtAIn is completely insulated from the high risk of the FDA approval process, which would be handled by the clients themselves.
Currently, larger pharmaceutical companies dominate the gene delivery space. Most of the vectors on the market and those offered by big pharma are viral vectors such as AAVs and lentivirus. Most companies, including emerging companies such as Iyer Therapeutics and Genzaig, are focused on using in vitro platforms to develop their vectors. However, we can see here that there are few companies using machine learning in this space to develop de novo protein nanoparticles. One company, Generative Biomedicines, has an AI model, Chroma, that is capable of developing PMPs, but their main focus is on using generative AI to develop novel antibody binders. Therefore, there are no companies currently doing exactly what we propose to do or are pursuing a business model with repeated de novo vehicle discovery.
Great idea by itself is not sufficient to create commercial value. To do that, we need to focus on that first value creation step, and that'll be our intensive focus for the next 21 months. The first step being proof of concept and a patentable product, followed by a customer who actually pays us to license the product. And we'll be developing those important customer relationships in parallel. We've estimated our costs for that first value creation step. As I mentioned, we think it'll take 21 months and cost $3.5 million with a team of about 7 people. And to be comfortable with that budget, we would go out and raise $4 to $5 million, preferably in non-dilutive funding foundations and grants, but also typical early stage funding like safes and convertible debt.
Great. Well, thank you very much. We're excited to begin disrupting the field of delivery. Thanks.